beautiful acacia country. But for the people of Samburu, it is not so much the beauty. This is where they eke out a living. Here too, under the acacia tree, the Samburu receive medication and health clinic run by a local non-governmental organization with support from the United Nations Population Fund, visits every village in Baragoi division of Samburu district. The Samburu may be a poor pastoralist people, but they know something about health insurance. A local non-governmental organization, Samburu Aid in Africa, or SAIDIA, has set up a community health care program. In this program, each Manyata contributes money for the community's health. It is a cost sharing by the community for the community. Under this scheme, each Manyata contributes 800 shillings per year. They're allowed to pay into installments of 400 shillings. The insurance covers the whole family for treatment and referral purposes at either of the NGO's health centers, Gilai or Lesirikan.
We were telling the communities that even the help that will probably, if we get any help, one day the help will withdraw, and if they are not involved now in their own health, then it will be a problem in the future.
Although the health centers have a general supply of drugs, the challenge is how to get the people here.
The average distances that they travel from their manyatas or villages is approximately 15 to 20 kilometers. That is the shortest distance they could come from. Others would come as far as from a distance of 60 kilometers or so.
The health center has only one ambulance covering a vast area, and according to Letipila, some of the patients die on their way to the health center. Those lucky to get here have more medicine than they will ever need. The problem is, the health center has no laboratory, and any diagnosis is only by the physical manifestation of the symptoms of the disease. But according to SAIDIA, the Samburu have come a long way in their fight against poverty and disease. Farida Karoney, KTN, Lesirikan, Samburu District. By the time the day breaks, the Samburu woman has been working for hours. She starts by milking the cows as early as 5 a.m. And by the time of taking this picture at 6:30, she was on the last cow. In Samburu culture, women do most of the work. They build the manyatas, fetch water for the animals, tend the young and sick animals, and care for the children. Our men do very little. They're just lazy about. She's not allowed to handle money unless heading for the nearest shopping center, which is a way to purchase food for the family. And while the Samburu woman breaks her spine laboring for the family, what is the man doing? Ntotoi, the Samburu version of a game of draft, is the man's favorite pastime. Unless there's a serious drought and the animals have to be taken afar grazing, or there's a heavy-duty community project like constructing a road or digging a well, the man will most likely be lazing away with Ntotoi. The woman has no say. During the rainy season, there's plenty of water and pasture. We have very little to do. They force their children out of school to herd livestock and marry off their young daughters for wealth, but will play Ntotoi with undivided attention. If there's a problem with the livestock, it's the Morans problem. Morans are a group of unmarried young men ranging from the age of 14 to about 30. The earliest a Moran can marry is at the age of 22. Culture can be as beautiful and as adorable as these babes traditionally adorned by a Samburu woman. But when culture begins to deny the Kenyan child the right to education and a woman the right to decide if they want to get married and who in fact they want to marry, then communities must be implored to shed those cultures that are harmful to them. Farida Karoney, KTN, Samburu District.